Hello, dear friends. Welcome back to The Gentle Path. I'm so glad you've decided to join me here today because, as always, we're diving into a topic that touches all of our lives in one way or another. Today, we're talking about walking, often seen as the simplest, most accessible way to stay active. But as we age, even something as basic as putting one foot in front of the other requires care and awareness. Now, let me begin by saying that movement is important, deeply important, no matter what stage of life we're in. Walking can help us stay limber, lift our mood, and maintain independence. But sometimes too much of even a good thing can be harmful. Today, we're going to explore situations where taking a gentler approach to walking might actually be the key to better health. I wonder, have you ever felt torn between staying active and listening to your body? That push and pull is something many of us wrestle with as the years go by. Let's start with a story about Eleanor, an 82-year-old woman I once knew. She loved her morning walks. They were her time to breathe in the fresh air and feel connected to the world around her. But occasionally she'd feel a little dizzy when standing up too quickly. Oh, it's just part of getting older, she'd tell herself. One day, she stepped out for her usual route, and partway through, she felt her vision swimming. And then, darkness. The next thing she remembered was waking up on the sidewalk with a fractured wrist. It was only after visiting her doctor that she learned her body had trouble regulating her blood pressure during movement, something called orthostatic hypotension. Isn't it humbling to realize how our bodies can turn on us when we least expect it? For those of you who experience dizziness, sudden fatigue, or even moments where you feel lightheaded during physical activity, it's your body trying to tell you something. Dr. Mariana Cruz, a leading geriatrician, often reminds her patients that staying hydrated and practicing safe, supported movement can make all the difference. She says, we should never ignore these warning signs. They're our body's signals to slow down and make thoughtful adjustments. Maybe that means bringing along a sturdy cane for balance, or perhaps switching to seated leg exercises on those days when energy feels low. Would you be willing to make those changes if it meant protecting yourself from harm? And then, there are seniors managing chronic heart conditions. Oh, this one is so close to my heart. No pun intended. Many folks find comfort in walking, believing it strengthens the heart, and often it does. But for people like Edward, a 79-year-old gentleman recovering from mild heart disease, too much exertion can strain the cardiovascular system. He felt breathless and fatigued after his walks, thinking he just needed to push harder, until the day his chest tightened in the middle of a longer than usual route, and he needed to be rushed to the hospital. You see, while the heart is resilient, it also has limits, especially if it's already been weakened by years of wear and tear. Edward learned, as we all do eventually, the importance of pacing himself. He started following a supervised exercise plan, focusing on balance rather than overexertion. And you know what? He felt better for it. This is why I encourage you, my friends, always to pay close attention to those little warnings your heart gives you. Shortness of breath, a fluttering sensation, or exhaustion that lingers longer than it should. No one knows your body better than you. Now, recovery from surgery or injury is another area where many of us struggle. Margaret, a spirited 75-year-old, had a knee replacement surgery and was determined to bounce back quickly. I could feel her determination. She was eager to reclaim her independence and prove to herself she wasn't slowing down, but she pushed herself, walking farther each day than her body was ready for. Soon, sharp pain brought her progress to a halt, and back she went to the doctor. The lesson here? Recovery isn't just about movement, it's about respect. Respect for the process and for the natural rhythms of healing. One helpful piece of advice I recently came across comes from the American Physical Therapy Association. Always follow the 15-minute rule. If an activity causes soreness or pain for more than 15 minutes afterward, it's your body's way of telling you to scale back. Isn't it interesting how small guidelines like that can make such a big difference? For those of you who struggle with peripheral neuropathy, nerve issues in the feet or legs that cause numbness and balance problems, walking can become hazardous. A dear friend of mine, Frank, discovered this the hard way. He had diabetic neuropathy, and when he didn't pay attention to a small blister on his heel, it turned into something serious, requiring weeks of treatment. And why did it worsen? Because Frank couldn't feel the pain while he was walking. That's the danger of nerve damage. It silences the body's natural alarms. Let's be mindful here, especially for those of you living with neuropathy or other nerve-related conditions. Supportive footwear, regular foot checks, and even choosing lower-impact activities like swimming can keep issues from snowballing. And remember, balance exercises can help too. Something as simple as holding onto the back of a chair and practicing a gentle heel-to-toe motion can strengthen your stability over time. Finally, we arrive at arthritis. It's such a common companion as we grow older, isn't it? But for some, swelling and stiffness in the joints become unbearable, especially in the knees, hips, or ankles. How many of us have pushed through that discomfort, believing we were doing something good for our health? I've been guilty of that myself. But doctors, including those at the Arthritis Foundation, caution against overloading inflamed joints. As counterintuitive as it seems, sometimes gentler activities, like cycling, swimming, or even chair yoga, nurture the joints far better than pounding the pavement does. I know, it's not always easy to embrace these changes. Perhaps you've been active all your life, and now you're confronting the need to adapt. But let me offer you this reassurance. Choosing to care for your body's unique needs is not weakness, it's wisdom. Aging gracefully isn't about how much we push, it's about how well we listen to ourselves, to our bodies, and to the experts whose guidance can keep us moving forward safely. So, my friends, as we come to the close of today's conversation, I want to ask you, have you seen yourself or a loved one in any of these scenarios? Perhaps you've felt that pull between pride and patience, between pushing forward and pulling back. I'd love for you to reflect on that and share your thoughts. Your words might just inspire another listener who's sorting through these same challenges. Thank you for joining me here today on the Gentle Path. Remember, small adjustments made today can lead to big rewards tomorrow. Health, independence, and the quiet joy of moving through life at just the right pace. Until next time, take care of yourselves and each other.